Thank you, John. Well, October is Breast Cancer Awareness Month, but did you know that 5 to 10% of breast cancers are thought to be hereditary? Joining us this morning, Dr. Farrell, a SLUCare breast surgeon. Good morning to you.
Good morning. Thanks for having me.
Absolutely. And Dr. Farrell, we've heard a lot about the breast cancer genes 1 and 2. What exactly are they and how do they differ?
Yeah, that's a great question. So a lot of times I have a lot of patients ask whether or not they qualify for genetic testing. And the short answer to that is that really not everyone will qualify for genetic testing. We recommend that between the ages of 25 and 30, women undergo a formal risk assessment by their doctor where they can have their specific risks identified, specifically their family history. So women that have a concerning family history with multiple family members with breast cancer and ovarian cancer may qualify for genetic testing. The most common breast cancer genes that we see are breast cancer gene 1 and 2, or the BRCA genes 1 and 2. And both are associated with breast and ovarian cancer. The risks differ a little bit, but if women can talk to their doctor and see if they qualify, then that would be very, very important to determine their personal risk.
Yeah, doctor, are there other genetic mutations that can raise your risk for breast cancer?
Yeah, we know of multiple genes now that can increase your risk for breast cancer. They include CHEK2, PALB2, and a number of other mutations. And a lot of times, if women can see a genetic counselor or have their risk assessment done, they can actually be tested for many of those genes.
Who should have genetic testing, and what does the screening look like?
So if a woman is high risk or has a genetic mutation, they may need to undergo screening at an earlier age. So for the average age woman, we recommend that she undergo testing beginning at the age of 40 and having a mammogram once per year. For women at increased risk because of their family history or a genetic mutation, they oftentimes qualify for genetic testing at an earlier age, and they may need the addition of a breast MRI in addition to the mammogram.
Now, if you have a gene mutation that's linked to a higher risk of breast cancer, is there anything you can do to lower your risk?
Absolutely. So I think it's very, very important that women talk to their specific doctors. But with the BRCA1 and 2 genes specifically, they're at higher risk of breast cancer and ovarian cancer. So from a breast standpoint, we recommend that they see a breast surgeon to talk about the increased screening, as I just mentioned. And then there's other risk reduction methods that women can do, which do include having a prophylactic mastectomy, meaning a double mastectomy to reduce their risk. And we also recommend that they see another doctor to talk about the risk of ovarian cancer as well.
Yeah, I know there's been a little bit of back and forth on how often you should get a breast exam. What is the latest on that if you do not have a hereditary risk?
That's a great question. So for the average risk woman, we recommend that she see her doctor once per year at least and have a clinical breast exam done by the doctor, in addition to a once per year mammogram.
Some great advice for us this morning, Dr. Farrell. Thank you so much. We appreciate it.
Thanks a lot.